Assalamu alaikum. This is Dr. Maaz Qureshi, and today we are going to be talking about Bohr's versus the Haldane effect. Okay, in order to understand this, you need to know the difference between the hemoglobin and the myoglobin. Each hemoglobin molecule has 4 binding sites, or also called as tetramer, where each oxygen molecule binds to the hemoglobin, and this is known as oxyhemoglobin. Now, the oxygen binds with the hemoglobin because there is higher affinity, or in Urdu we can say कि उसकी liking towards the hemoglobin is more, or willingness to connect with the willingness of the oxygen to connect with the hemoglobin is more. On the other hand, when we talk about the myoglobin, it has less affinity for oxygen. Hence, more of the oxygen goes in the tissues, and that is because of the monomer, or the single binding site of the oxygen, one oxygen molecule. Okay, so now what is oxygen hemoglobin curve, or ODC, oxygen dissociation curve? This is a curve between oxygen saturation, this being the 100%, and this is your partial pressure of oxygen. Partial pressure of oxygen, basically your partial pressure of oxygen is basically through your ABGs, while your oxygen saturation is calculated or measured through pulse oximetry. So normally what it happens is that you have this increased oxygen levels, and the hemoglobin attach with the oxygen until a plateau phase comes and you have saturated the hemoglobin levels. This is your normal level. Now let us look what will happen if this curve shifts towards the right side, or we can say that it becomes or affects the Bohr, or the Bohr's effect, whatever you can call it. So what will happen is there will be increased oxygen affinity, and you will have more oxygen unloading towards the tissues, which means that more oxygen towards your tissues, hence less oxygen attached towards the hemoglobin. Vice versa, on the other hand, if we take the same graph and we increase and we shift it towards the left side, as you can see that it will take more and more oxygen level or oxygen saturation of within the hemoglobin, or it will take more oxygen for the saturation of the hemoglobin to reach a plateau phase. Hence, when it reaches that point, it can be called as the Haldane effect, where the oxygen unloading or oxygen affinity for the hemoglobin, oxygen affinity towards your hemoglobin is more comparatively towards your tissues. Hence, less oxygen towards the tissues. So, what is the difference between these two? Here's your Bohrs and here's your Haldanes. So in Bohrs, you can see that there is more oxygen to unloading towards the tissues, hence less oxygen affinity of the hemoglobin towards oxygen. And this happens when you have more proton in your body, hence more acidity or less pH. Or in short, we can say that when there is respiratory acidosis, when the PCO2 is up, or when there is less hydrogen carbonate provided by the nephron, or when there is more 2,3 diphospho DPG glycerate, or biphospho-glycerate. Okay, this is known as your right shift, and here you have less oxygen affinity towards your tissues, more oxygen affinity towards your hemoglobin. Affinity here means that there is more willingness to attach or more love between the hemoglobin and your oxygen. So when does the Haldane effect takes place? So when it is quite opposite of the Bohrs. So here you have increased hydrogen ions, you will have decreased hydrogen ions in this one, which means more alkaline, more alkali. When you have more less PCO2 and more hydrogen carbonates, or similarly when you have less 2,3 DPG. Another thing which is really important is that adult hemoglobin has 2 alpha and 2 beta chains, while the hemoglobin F, which is basically your fetal hemoglobin, has 2 alpha and 2 gamma, which has more affinity for hemoglobin, more affinity of the hemoglobin comparatively to your adult hemoglobin. So that is all for today. If you liked this video, if it helped clear some concepts, do subscribe. I just forgot the spelling of subscribe, I guess. Do subscribe on my YouTube channel, follow us on our Facebook channel or Facebook page, and do hit us on My Insta. Yep. Whatever. This is Insta. Get it? Got it? Good.